So do you have dry or dehydrated skin? Did you know there's actually a difference between the two? So you have to know the appearance of what it looks like so that you can actually treat it, and it's actually two opposite ways. So if you're experiencing dry, flaky, itchy, scaly, sensitized skin, you may have dry or dehydrated skin. So as we're getting into the cold winter months and we start experiencing oscillating temperatures between the outside cold air and the heater inside, which dries out the air as well as dehydrates your skin, then your skin starts to experience more chapped, flaky, itchy skin conditions. So dehydrated versus dry skin, it's often a misdiagnosed and misunderstood skin condition. Hi, my name is Christy and I'm the owner of Go See Christy Beauty Boutique, and I have been treating people with acne, hyperpigmentation, helping to fight or slow down aging, as well as other skin conditions like eczema, psoriasis, and a number of other skin conditions for over 10 years in Southern California. And we're going to talk about, once again, dry versus dehydrated skin in the wintertime. So first we're going to talk about the top layer of the skin, most commonly known as the epidermis, but more specifically it's known as the stratum corneum. Now the stratum corneum actually plays a key role in the function, the health, and the maintenance of your skin. So I want you to picture a brick wall. Okay, so the individual bricks, that's going to represent the corneocytes, or the dead skin cells. The dead skin cells are actually a complex integration of salts, amino acids, urea, lactic acids. And this is referred to as the natural moisturizing factor, or NMF. So the mortar or the cement in between that holds those bricks together, that is the intercellular cement, intercellular bond, or intercellular glue. Those are all used interchangeably. That cement or that mortar is actually made up of ceramides, fatty acids, as well as cholesterol. So the mortar, or basically they essentially organize themselves into layers of the skin, which creates a water binding material for the skin. Now, when there is a breakdown in that cement, so to speak, or it starts to break down, then the skin loses its ability to hold on to its own moisture. Now, ceramides are natural lipids that holds the skin cells together. Ceramides are actually vital for moisturized skin. So when there is a breakdown in the ceramides, then your skin will become dry, irritated, and sensitized. Now, I've actually mentioned this in a lot of my other videos, but when your skin starts to lose its own moisture, loses its ability to hold on to its moisture, then you start to experience TOOL, and that's called transepidermal water loss. This can lead to inflammation, and with additional UV exposure, it could actually lead to the breakdown of the extracellular matrix. Now, without enough moisture, the natural desquamation process is interrupted. And if you haven't been watching my other videos, desquamation is the speed at which the skin cell turns over. So skin cell turnover rate. So when the desquamation rate is interrupted due to the lack of moisture, then the result of the appearance of the skin just overall looks more aged. You get dry, you get flaky skin, dull looking skin, more sensitized skin, a decrease in elasticity, as well as just the overall appearance of it just looks more dull. So when you have a buildup of dead skin cells, this not only traps the dirt and debris, it actually decreases your skin's ability to absorb any anti-aging ingredients or acne-fighting ingredients or any other products that you apply onto your face. So we're going to start with myth number 1 about dry and dehydrated skin. And myth number 1 is, I have dehydrated or dry skin because I don't drink enough water. And that's not exactly true. Yes, drinking water, how it actually helps the skin is when you drink a lot of water, what immediately happens is about 20 to 30 minutes later, you're going to have to go to the bathroom. Your body will direct that water to the excretory system first before it even reaches the superficial layers of the skin. And that is what it's designed to survive. So it's designed to flush out all of your toxins, all of your metabolic waste. So how it helps the skin indirectly is that it flushes out all of the waste so that you have better skin tone. So if you've ever seen someone who is very sickly, they're not eating a lot, they're not moving around a lot, they're not drinking water a lot, they will have kind of this grayish tinge undertone on their skin. And so drinking water flushes out a lot of the waste before it even reaches the top layers of the skin. So that is not necessarily true. So dehydrated skin is actually the result more of extrinsic factors more than intrinsic factors. So dehydrated skin is actually the lack of water in the skin and a stripped acid mantle. So here are some of the extrinsic factors that cause dehydrated skin. So one, first of all, is the lack of products that are on your skin to help draw moisture into the skin, not using the products correctly, as well as environmental factors such as heat, wind, dry air. So a lot of it has to do with your environment. So the clinical appearance of dehydrated skin is crinkly and flaky skin, but shiny looking skin. So it almost has a cellophane look to the skin. This is especially obvious when a client has oily skin, but it's also dehydrated. So what happens is the oil gets trapped under that flaky and oily skin. Sometimes you'll see it with clients who have been using Retin-A or they've done an acid peel recently. They'll have really shiny, tight-looking skin, but it's also kind of crinkly, and that is a symptom of dehydrated skin. So if you'll notice that when someone does an acid peel, when they're using Retin-A or retinoids or glycolic acid or any type of product that helps them exfoliate a lot faster, you are compromising the lipid barrier, which then draws out the moisture, which then compromises the ceramides, and so that's why you get that appearance of the dehydrated skin. So before I get to the next myth, if this information is really helping you and you find it educational and it helps you further your knowledge in skincare, I would just love it if you would hit the like button, because that would tell me that this is the kind of information that you're looking for. And if you haven't already, to please go ahead and hit the subscribe button and the notification bell to get notified of our newest videos. Okay, so on to myth number 2. So myth number 2 I hear a lot of times is, oh, I need a really heavy night cream, or I really need a heavy cream because my skin is dry. Dehydrated skin actually does not need heavy cream. It needs water and not oil. And I will be explaining to you the differences between the two. So heavier creams that especially say that it is created for or formulated for dry skin, what it does to dehydrated skin is it actually sits on top of the dehydrated skin, and it doesn't add any additional moisture, which is water, into the skin. So what this can do to dehydrated skin that wants water is it can actually leave the skin feeling greasy. And if you feel the actual texture of your skin, it doesn't feel like it has any moisture. It just feels like it's dry underneath and it's just kind of slippery. So that's when you know you have dehydrated skin. So when your skin is dehydrated, how it needs moisture is it needs it from water versus oil. And oil is occlusive. So we're going to talk about the differences between occlusives and humectants. So for those of you out there who have oily skin or breakout prone skin, I can already hear you guys saying, I don't need any moisturizers. A lot of my acne prone clients who come in here and I tell them your skin is dehydrated, it's producing too much oil, which then feeds the bacteria that causes the acne, they do not want to use moisturizers. And so what is happening is that when you use acne fighting ingredients, that actually absorbs a lot of the oil. So their skin starts to get dry, dehydrated, flaky, and then that clears up the acne. Well, then they think, okay, my face is finally clear, I'm not going to add any more moisturizers to the skin. Well, your skin needs water-based moisturizers versus oil-based moisturizers. So the oil-based moisturizers, they're occlusive. They keep moisture in and keep the moisture from evaporating. It does not add any moisture to the skin, and when your skin is dehydrated, it needs water. So for my acne breakout prone clients out there, as well as people who are listening to the video, is that you do need a moisturizer. You just need a water-based one, not an oil-based one, because when your skin is dehydrated, your skin will actually overproduce oil to basically slow down its own moisture loss, and then it causes more acne. So for all my acne clients out there and for people who are struggling with oily skin or breakout prone skin, this is why all of you shy away from moisturizers, because you think that it makes you break out. So yes, kind of, but not really. So typically when you're using a oil control or an acne medicated product to control the acne, it actually sucks up all the oil because bacteria feeds off the lipids or the oil on your skin. And so when you typically put on lotions, creams, or oils, it makes you break out because when you're drying out your skin, you're over dehydrating your skin. So you need to add water-based or binding humectants onto your skin, because guess what, you guys? If you increase the moisture levels in your skin, you actually produce less oil, which then results in less breakouts. So you want to look for that. And so we're going to be talking about the differences in just a moment. So remember, oil causes breakouts in breakout prone skin or oily prone skin, and water increases the hydration. And so when you hydrate your skin, you produce less oil. Dehydrated skin or dehydration to the skin actually causes more damage to the skin than dry skin ever will. Now, many people of you out there who think that you have sensitive skin, you actually have sensitized skin. Your skin is sensitized because your skin is dehydrated, and it's been dehydrated for an extended period of time. So you don't have an acid mantle. It's stripped, and therefore you start experiencing the dry, flaky, itchy, red, chapped skin. Now, sensitization is actually one of the worst results of dehydrated skin, because when you have dehydrated skin, the inflammation signals the metalloproteinases, otherwise known as MMPs, to break down the existing collagen, which what does that do? It actually causes premature aging. So believe it or not, dehydrated skin actually increases premature aging of the skin almost more than anything else. So I keep talking about humectants, how they draw moisture to the skin and in the skin, and occlusives actually keep the moisture in. I'm going to actually put links in the description below for specific products so you can tell the difference between the two. So the first one we're going to talk about are humectants. These are some ingredients that you can look for in your products, and the higher they are up in the ingredients list, the better it is. So the first one is glycerin or urea. So basically what that does is usually they are vegetable-based humectants, and it draws moisture to the skin and in the skin, and it actually adds moisture in the skin cells as well. The next one is sodium PCA. So if you see this in your ingredients, it actually holds up to 250 times its weight in water. The next one is lactic acid. It is a gentle exfoliating acid. It's an AHA, but it is a hydrophilic acid, which means water loving. So it binds the moisture or binds the water into your skin. It also helps with exfoliating and treating hyperpigmentation. And the big guns for humectants is, of course, hyaluronic acid, or otherwise known as sodium hyaluronate. And so that is also a moisture binding or water binding molecule, and it can hold up to 1,000 times its weight in water. So it is a big time humectant, so it actually draws moisture from the air or from products, binds it into your skin. Okay, so the next category we're going to talk about is occlusives. So what occlusives do is they actually lock in the moisture that the humectants have brought into your skin. So this is a situation where you can use the two hand in hand. So your skin always needs the humectants first and then the occlusives on top of that. So we're going to talk about occlusives. So I wanted to say that products that contain occlusives, the best way to use that is right after you've gotten out of the shower, make sure that you do not completely dry off. So like you can dry off your crotch area and your underarm area so that you don't get yeast growth there, but you kind of just want to pat yourself dry, make sure your skin is moist, and then from the steam and the heat, your skin is moist, your pores are open. That's when the best time to put lotion or creams on, because that's going to seal in that water that's already on your skin. So that is the best way to use occlusive. So whether it's a after shower, after bath oil, or lotion. So once again, I do want to emphasize this because this gets mixed up with my clients and I see them all the time. So if you're only watching this video one time, you may get confused. So occlusive agents, they do not add moisture to the skin. A lot of them they have limited benefits, so they basically lock the moisture in your skin. Now here are some occlusives that have no benefit to the skin, so these are ones that people who are breakout prone or oily skin should avoid, and that is petroleum, otherwise known as petrolatum, mineral oil, and lanolin. So lanolin, some people they get reactive to that. And lanolin is actually basically sheep sebum. So here are 3 occlusive agents that actually have some benefits to your skin. So the first one is sweet almond oil. It's high in an antioxidant, which is vitamin E. The second one is jojoba oil. So jojoba oil is actually very close to the human sebum, so it actually gets into your skin very easily. And it also contains essential fatty acids as well as some antioxidants. And the other one is shea butter. So shea butter is extremely beneficial for dry skin without feeling greasy. So what shea butter has is it actually has essential fatty acids, triglycerides, and vitamin A and E. And I actually, come to think of it, there is another one, niacinamide. So niacinamide actually reduces breakouts. It actually increases ceramide and essential fatty acid production or levels, as well as reduces tool. So niacinamide in the retail arena, it's actually more touted as an anti-aging agent, but it actually is an occlusive agent as well. So it helps reduce moisture loss. Okay, so here comes the pro tip. The pro tip is, so hyaluronic acid serum is not only a humectant, but it also acts as an occlusive agent, and it never breaks you out because we make it in our own bodies. So hyaluronic acid, as mentioned before, it can hold up to 1,000 times its weight in water. So it draws in moisture, acting like a humectant, but molecularly it's larger. so it doesn't really penetrate the skin, and it actually not only quenches the thirst of the skin, so to speak, but it also acts as an occlusive agent to seal in more moisture. So if you can use an hyaluronic acid serum, it would actually greatly make your skin, increases your skin's ability to hold in the moisture without breaking you out or making you feel greasy. So the correct way to use an hyaluronic acid serum is, and the more effective way to increase the absorption rate in the skin is after cleansing, you want to exfoliate, and exfoliating only at night preferably. So you exfoliate, then on clean dry skin, you add the serum. Most serums, you do have to wait about 10 minutes to let it penetrate, but the great thing about hyaluronic acid is it is hydrophilic. It loves water, and it is going to be pH compatible to any of the products that you use. So while your skin is still moist using the hyaluronic acid serum, use a toner, a spray toner. Spray your face with toner until it's completely saturated, and then again, while your face is still wet, you're going to apply the occlusive agent, which is your moisturizer, your lotion, or your cream. So if you don't really understand the order and the correct way to use the products, then click the link up above and it will link you to the correct way to use the products. So that is the one that you would need to watch after this one.